Welcome back to this presentation on contraceptive methods. Contraceptive methods prepare individuals or couples to plan their timing, number and spacing of pregnancy. They can greatly reduce the chances of having an unplanned pregnancy and at the same time protect from contracting STIs. This presentation will focus on different methods of contraception, how they work and how effective they are. The learning goals are 1. Highlight on the benefits of contraception. 2. Categorize the birth control methods based on how they work. 3. Describe the advantages and disadvantages of the different contraceptive methods. 4. Arrange contraceptives in order of their effectiveness. And 5. Describe the correct ways to use the contraceptives. A method or device used to prevent pregnancy is called as contraception or birth control method. Contraceptive methods have a range of benefits other than their primary purpose of preventing unplanned pregnancy. Contraception can also reduce the number of unsafe abortions, can even lower your risk of contracting STDs including HIV. It can also reduce MMR and IMR, and it can maintain a suitable population size. And at the same time, some of the hormonal contraceptive methods may offer other health benefits like reducing acne, making periods lighter, relieving menstrual cramps and PID, and reducing the risk of uterine and ovarian cancer. Today, there are so many effective and different birth control methods, including natural methods, barrier methods, hormonal methods, emergency contraceptive methods, and permanent methods. All of these methods work in a special way to prevent pregnancy. In general, they work by either physically blocking the sperm from meeting the egg or killing the sperms inside the vagina before they can reach the uterus, or preventing the egg from getting released from the ovaries, and by creating hostile conditions such as thickening of the cervical mucus or by thinning of the uterine endometrium. Let me now introduce you to the specific methods one by one. At the beginning, let us take the most safest and natural ways of preventing pregnancy. These methods in general does not involve the use of any medication or devices. Many couples practice a natural method called periodic abstinence or the calendar method. What we know about the reproductive cycle in females is that there is a very short period or window during which an egg is available for fertilization by a sperm in the fallopian tube. The short time of the month just before, during and after ovulation is considered to be the fertile window or the fertile period of the month. With this in mind, sexual intercourse is abstained during these fertile days. Multiple methods of tracking is necessary to identify the fertile days and to increase with the effectiveness of periodic abstinence. Using a combination of methods that helps to identify the fertile days, such as calendar method, ovulation test kit method, cervical mucus method, and basal body temperature method might be effective. But in most cases, it's just too difficult to predict the exact day of ovulation for many of the women. And on an average, this method is between 80 to 87% effective at preventing pregnancy. It can be an effective choice for women who can invest time and effort to study their menstrual cycle over a long period of time and consequently become aware of their fertile days. But some of the drawbacks are it requires a lot of practice and time to learn or pinpoint the fertile days, and it is less appropriate for females with irregular menstrual cycle. Effectiveness of this method can be intensified by using condoms. Lots of people also rely on another natural method called the pull-out or withdrawal method. In this method, the male partner pulls out the penis from the vagina before ejaculation or release of semen. And this method is also called coitus interruptus. Now, for withdrawal to work, the male partner must always pull out before ejaculation, and this requires a healthy relationship where both partners are equally committed to preventing pregnancy. Withdrawal method is 80 to 96% effective if done correctly. One of the key reasons withdrawal is used is it's free and it's always an option whenever other birth control methods are out of place. Apart from this, it has no side effects. But nevertheless, it should be noted that withdrawal requires a lot of self-control and trust. There is also the risk of premature ejaculation in some males. Withdrawal can be made more effective with the use of spermicides. Now, yet another form of natural birth control method is the highly effective yet short-term method suitable for breastfeeding women. This is called as lactational amenorrhea method. Women who are fully or exclusively breastfeeding their babies do not ovulate or do not have their menstrual period for 3 to 6 months because of the increased level of prolactin hormone. And to practice lactational amenorrhea method, a woman needs to meet 3 of these conditions. 1, she should not have her monthly bleeding yet. 2, the baby is fully or nearly fully breastfed and is fed frequently both during the day and night. And 3, the baby is less than 6 months old. Now, if a woman meets all the 3 criteria and she uses every opportunity to breastfeed her baby, the effectiveness of lactational amenorrhea method is about 98%. The benefits of lactational amenorrhea method is profound to both mother and baby. It contributes to optimal breastfeeding practice and therefore enhances maternal and infant health and nutrition. That said, the disadvantages of this method includes its limited period of effectiveness and the need to breastfeed frequently. The only birth control method that is 100% effective in preventing pregnancy as well as STI is abstinence. Sexual abstinence means not having sexual intercourse and eliminating all chances of sperm entering into the female reproductive tract. However, this method may be highly difficult to be practiced for a long period of time, and it does require acceptance and cooperation from the other partner. To sum up, natural birth control methods are safe with no side effects or potential health risk. It is mostly free and convenient to use. But at the same time, natural birth control methods have higher risk of failure and requires partner consent and cooperation. And all the natural birth control methods can offer no protection against STDs except for the complete sexual abstinence. Another broad category of contraceptive methods are the barrier methods. They are designed to prevent the passage of sperms into the uterus or to kill the sperms before they can reach the uterus. Barrier contraceptives include physical barriers like the male and female condoms, diaphragms, and cervical caps, or chemical barriers or spermicides. Spermicides are sperm-killing chemicals available in different forms such as foams, creams, gels, films, or suppositories. Spermicides can be used alone as contraception, or it can be also used with other contraceptive methods like condoms, diaphragms, or cervical caps. Spermicides used alone is about 70 to 80% effective, but when used together with condom, its effectiveness is about 97%. Spermicides are applied or inserted deep into the vagina about 1 hour before sexual intercourse, and it's inexpensive, easily available in the drugstore without prescription. On the negative side, spermicides are the least effective form of birth control on their own. Some people may also develop allergic reaction to spermicides or can also cause urinary tract infection. The male condom is one of the most widely used barrier methods in the world, and it is a thin rubber covering made to fit over a man's penis. It works by providing a physical barrier for the semen containing sperms from entering into the vagina and uterus. Condoms are very effective in preventing pregnancy, and when used consistently and correctly, male condoms are 98% effective in preventing pregnancy. A female condom is a thin, loose-fitting, flexible plastic pouch which is placed inside the vagina. It has two soft rings on each end. The soft ring at the close end of the pouch covers the cervix, and the other ring at the open end of the pouch stays outside the vagina and partially covers the labia. Like the male condoms, female condoms provide barrier between sperms and egg. Female condoms can be inserted up to 8 hours before intercourse, and the outer ring needs to be held in place during intercourse. After intercourse, the outer ring is twisted and the condom is carefully pulled out from the vagina. The female condom is 95% effective if they are used consistently and correctly. Above all condoms are the very effective birth control methods that can protect us against STDs, including HIV. It is also cheap, easily available, and has no hormones. Although it can be used easily by anyone, there's a chance that the condoms could break or slip off during sexual intercourse. It's especially important to make sure that the rim of the male condom always stays near the base of the penis during sexual intercourse. And it should be noted that the male and the female condoms must not be used at the same time, as this can cause breakage or tearing. The next barrier methods are the diaphragm and cervical caps. Both of these devices are a small dome-shaped cups that fits over the cervix. The cup acts as a physical barrier against the entry of sperm into the uterus. A woman needs to be trained on how to insert the device correctly. An advantage is that diaphragm can be inserted before the sexual intercourse, as well as cervical caps can be inserted up to 42 hours before sexual intercourse. A small amount of spermicide is usually placed inside the cup before the insertion in order to increase with their effectiveness. Both diaphragm and cervical cups should be left inside for at least 6 hours after sexual intercourse to make sure that all sperms has been killed. There are no side effects or major health risks unless one is allergic to the latex material or spermicides. Additionally, some women may develop urinary tract infection or vaginal irritation. As a general rule, diaphragm and cervical caps should be replaced every year. And when used correctly with spermicide, a diaphragm or cervical cap is 92 to 96% effective at preventing pregnancy. In short, all barrier methods of contraception generally do not have the side effects of hormonal contraceptives. Some forms of barrier contraceptives, including condoms and spermicides, are obtained easily without a prescription. And most importantly, condoms are the only birth control methods that can protect us against STDs when used correctly and consistently. The downside to the use of the barrier contraception is latex allergy, UTIs, accidental breakage or slippage during intercourse, and the lower effectiveness in general. Now, the next category of contraceptions prevent pregnancy primarily by releasing hormones. Hormonal contraceptives are of two types, which can be releasing both estrogen and progestin, called as the combined contraceptive contraceptives, and release progestin only contraceptives, which can only release progestin. Now, both of these work similarly. They can prevent ovulation or they can make the cervical mucus much thicker so that it will be harder for the sperms to go through the uterus, and it can also be causing thinning of the uterine lining, thereby preventing implantation. Within the combined hormonal contraceptives are the vaginal rings, which are a small flexible plastic ring that is inserted into the vagina. The ring releases both estrogen and progestin. The ring can be easily used and there's no wrong way or position to insert the ring into the vagina. However, it is important to keep track of the timing of the insertion of the ring. The ring is left in the vagina for 3 weeks in a row and then removed for 1 week. The new ring is to be inserted after the end of the ring-free week and the cycle is to be continued. The vaginal ring is 99% effective if used correctly. Apart from contraception, it also offers other benefits such as lighter periods, fewer menstrual cramps, and lesser acne. On the other hand, a major disadvantage of vaginal ring is the increased risk of blood clots, heart attack, and strokes in women who are overweight. Next, a birth control patch is a thin plastic adhesive that is worn or stuck on some of the places like lower abdomen, buttock, the back, or the upper arm. Patch releases steady amounts of both estrogen and progestin. A new patch is to be worn on each week for 3 weeks in a row, and the 4th week is the patch-free week. Following the 7 days of patch-free days, a new cycle is to be started, and the patch should be changed on the same day each week and should never be off for more than 7 days. Apart from being a very effective and easy to use contraception, it also offers other benefits like the vaginal ring. Some negative sides, on the negative sides of the patches are that they may cause some kind of irritation of the skin under the patch and may also cause irregular bleeding or spotting between periods. Birth control patch is 99% effective if used correctly. Oral contraceptive pills are the most widely used hormonal contraception and there are 2 main kinds of oral contraceptive pills. Combined oral contraceptive pills which contain both estrogen and progestin, and progestin only pills or mini pills that contain only progestin. However, both of these birth control pills work in similar ways. Pills are required to be taken every day at the same time, and most conventional birth control pills are to be taken 3 weeks at a time, followed by a pill-free week. The birth control pills are 99% effective if used correctly. The effectiveness of mini pills may decrease if the pill is not taken at the same time each day. And what's even better is that both of these pills can reduce menstrual cramps, lower blood loss, and lessen acne. But that said, the most common side effects of pills are spotting, bleeding between periods, nausea, and headaches. And combined pills can cause even more serious side effects like blood clots in legs or lungs, heart attack, increased blood pressure, or strokes in women especially who smoke and who are over 35 years of age. As an attempt to reduce the side effects and health risk of combined oral contraceptive pills, scientists at the Central Drug Research Institute based in Lucknow had successfully developed and launched a much safer once-a-week oral contraceptive pill called Saheli or Chaya. It's a non-hormonal, non-steroidal oral pill that prevents implantation of fertilized egg in the uterus. Unlike conventional pills, Chaya is taken for twice a week for the first 3 months and once a week thereafter. It has no major side effects as compared to the conventional hormonal pills, and it is safe for women of all ages and can also be used by breastfeeding mothers immediately after delivery. Within the progestin-only contraceptives are the birth control shots, IUDs, and implants. Birth control shot is a hormonal injection that contains progestin. Each shot lasts for 3 months and it is important to get the shot on time. Birth control shot is 99% effective if the shots are received on time. But the side effects of birth control shot can include heavy bleeding in the beginning, weight gain, breast tenderness, headaches and nausea. Due to higher levels of hormone in the shot, it takes more time for a woman to become pregnant once the shot is stopped. Using the shot for over more than 2 years may cause bone thinning in some of the users. It is therefore important for a woman to research all the options thoroughly and to consult the doctor for any questions and concerns. If any unpleasant side effects doesn't go away, or if one method doesn't work for you, there's always a way to try another option that suits your need and your lifestyle. Well, another method of birth control are the long-term contraceptive IUDs. IUD stands for Intra-Uterine Devices. It's a small T-shaped flexible plastic device that is placed in the uterus by a healthcare professional. IUDs are of two types, hormonal IUDs and non-hormonal IUDs. Hormonal IUDs release progestin and can prevent pregnancy for up to 5 years. In addition to preventing pregnancy, hormonal IUDs can also help with period problems. It can lower menstrual cramp and make the period much lighter. Some women may stop getting their periods altogether because of the thinning of the uterus over time. And there is no danger at all if the period stops. In fact, there is no medical benefit of period to a female. Hormonal IUDs are more than 99% effective. But some of the disadvantages of hormonal IUDs include just like for any other birth control method, the non-protection from STDs and may also cause pelvic infection in some. The non-hormonal copper IUD contains no hormone and is made with copper and plastic. The copper released from such IUDs act as a spermicide and prevent sperms from reaching and fertilizing the egg. Copper IUD starts preventing pregnancy as soon as it's placed in the uterus. And as a matter of fact, copper IUD is an extremely effective emergency contraceptive when placed within 5 days of unprotected sexual intercourse. However, shortly after placement, women may experience menstrual cramp and heavy bleeding during their periods. It may also cause pelvic infection in some females. Copper IUDs can prevent pregnancy for up to 10 years and is more than 99% effective. Another highly effective hormonal birth control method is the contraceptive implant. Contraceptive implant contains progestin and it's a thin matchstick-sized plastic rod that is placed under the skin of the upper arm. Implant will prevent pregnancy for up to 3 years and it can be removed anytime if a woman decides to get pregnant or for any other reason. Implants, in fact, is the most effective long-acting reversible methods of birth control. It is more than 99% effective. The most common side effects can include irregular periods, spotting or heavier bleeding, weight gain, mood swings, headaches, and acne. In spite of all these protective methods, if the partners have had unprotected sex and wishes to prevent the potential pregnancy, there is this method called the emergency contraception. Emergency contraceptive pills are easily available without prescription and they contain progestin. Emergency contraceptive pills should be taken within 3 to 5 days after unprotected sex and it's always more effective if the pill is taken sooner. As said earlier, copper TIUD can also be a very effective emergency contraceptive if placed within 5 days after unprotected sex. Copper IUDs are over 99% effective while emergency pills are around 88% effective. Emergency contraceptive pills can also cause certain kind of the nausea, vomiting, stomach pain, and headaches. And last but not the least, the permanent methods of birth control are the male and female sterilization methods, which are irreversible and permanent. The procedure for men is called as vasectomy, and for women it's called as tubectomy. Permanent method or sterilization is to be decided if you know for sure that you do not want to be having any more children. Vasectomy is a procedure where a small incision or cut is made in the man's scrotum, and the two tubes called as vas deferens that carry sperms are to be cut and tied off. This would prevent the release of sperms into the semen. While tubectomy is a surgical procedure where incisions are made in the abdomen and the two fallopian tubes are cut, tied and sealed. This would prevent the egg from moving down the fallopian tube as well as blocking the sperm from reaching to the eggs. Vasectomy and tubectomy effectively prevents pregnancy permanently, but just like any other birth control methods, sterilization offers no protection against STD. So the use of condom is therefore always recommended for any kind of birth control methods. And sterilization is irreversible and may also cause infection in some cases. So there is today a wide variety of contraceptive methods available and which are highly effective in preventing unplanned pregnancy. Continued research is being performed in order to improve and develop ideal contraceptives that are user-friendly, easily available, and very effective. The best method of birth control for you is the one that is safe, comfortable for you to use, and can be used correctly and consistently. And knowing your options is definitely the most important element of your decision. Always remember that no birth control method is perfect and you can change your methods whenever it is necessary. Stay informed and I'll catch up with my next video.